Let's talk about aminoglycosides for a little bit. Now, aminoglycosides are antibiotics, and it's important that you understand these drugs on the NCLEX because these are drugs that a lot of other new graduate nurses know. So again, remember when you're studying, focus on the things that everyone else knows. You don't want to dig too deep into pharmacology because if you were to go out and to ask a bunch of new graduate nurses, anybody walking in to take the NCLEX, what part of your nursing knowledge are you least confident? And the likely response that you're going to get is that they're not comfortable with their pharmacology knowledge. But this is the case with most nurses. This is where most nurses are uncomfortable with their knowledge, is typically in pharmacology. So for pharmacology, I don't want you to worry so much about memorizing the doses and the routes and the frequencies of drugs. Those are things that are good to know, but those are things that are medical decisions that doctors are going to tell you in the orders what you should have. It's good to have sort of a basic fundamental knowledge of how different drugs are administered, the routes so that you know when to question it. And you're going to see for aminoglycosides that the route can be important to know. So take that advice with a grain of salt and apply it to each drug that you're studying independently. Now, aminoglycosides, like I mentioned, they're antibiotics, and these are big gun antibiotics. Okay, these are the drugs that get pulled out when our patients have serious infections. So aminoglycosides, in the three blanks here, I want you to write the three words mean, old, and mycin. Okay, so aminoglycosides are mean old mycins. So what I want you to think of, when you say amino or mean old, amine old, they sound very similar, right? So aminoglycosides are mean old mycins. So in the future, anytime you ever hear the word aminoglycoside, I want you to think a mean old mycin. Okay. And mean old mycins are used to treat serious, life-threatening illnesses. Okay. So when do you think we're going to pull out the big guns, right? For serious, life-threatening illnesses and infections. So do you think that you're going to see an aminoglycoside prescribed for sinusitis or bronchitis? No, right? Those are not serious life-threatening illnesses. But how about something like tuberculosis or MRSA or something like sepsis or peritonitis? Okay. Yeah, for those you're going to see something like an aminoglycoside or amine old mycin, as we're going to refer to them from here on out, being prescribed. Okay, these are serious antibiotics. They're so potent that there's a number of side effects that we need to watch out for. We're going to talk about that here in a little bit. But they're so potent that these drugs can be used to treat cancer. So there's a handful of antibiotics that are aminomycins that are used to treat cancer. They're so potent. So that's why we need to know about them, because there are side effects for aminomycins that are noteworthy. So, okay, mycin madness. Now, all aminoglycosides end in the word mycin, M-Y-C-I-N. Okay, but not all drugs that end in mycin are aminoglycosides. For example, the thromycins. Okay, so, examples of aminoglycosides that end in mycin are, cliomycin, clindamycin, vancomycin, streptomycin. There's a bunch of these different mean old mycins. So what I want you to do when you see the word mycin on any drug that you're taking, that you receive on the NCLEX, is to check and see, is it a thromycin? Okay, and if it's a thromycin, then throw it out, right? It's not a mean old mycin. It's not an aminoglycoside. And I mentioned not to focus too much on routes previously, the route of administration, but you're going to see mean old mycins typically given IV or IM, and but for the thromycins, stuff like erythromycin, zithromycin, and clarithromycin, that's the only three thromycins there are actually, and those are given PO. Now, you have zithromycin and azithromycin, but it's the same thing. So those are typically given PO. Right? Now, for toxicity. Toxicity is important to know for aminomycins. And what I want you to think about is this. When you think of when we said mycin, what does that sound like? What animal does that sound like? It sounds like mice, right? So what's the most famous feature of the world's most famous mouse? That's his ears, right? So the world's most famous mouse has very famous ears. And so what I want you to think about for toxicity and side effects of aminomycins is the toxic effect of ototoxicity. They are toxic to your ears. Okay, so for your ears, what should you monitor? There's two things that your ears control. One is your hearing. The second is your balance. Okay, so for your ears, what you want to monitor is your hearing, your balance, and the other thing is for ringing. Right. Now, you may not see it written like that, hearing, balance, or ringing. You may see something like auditory acuity. That means hearing, right? You might see vertigo or equilibrium, both referring to balance. Or you might see tinnitus, right, referring to ringing. So remember, the NCLEX is a vocabulary exam as much as anything else. So, look for synonyms, words that mean the same thing. Right? Sometimes you might see a mixture of words used written in medical terminology or in plain English. Right? And they might be in the same answer. Some medical terminology and some plain English. You'll see those mixed up a bunch. Or you might see two of the answers written in medical terminology and two written in plain English. They mix it up on you. So make sure that you understand what the words mean before you start answering the question. Don't jump right to it. So now, the human ear is shaped like what? If you were to draw a human ear on a sheet of paper, it looks very similar, substantially similar to a kidney, to a human kidney. Okay, so the other toxic effect that you need to monitor is nephrotoxicity. Okay, so for that, you need to monitor kidney function, and kidney function is best monitored by looking at your creatinine. Okay, so you might see a 24-hour creatinine clearance test ordered for one of these patients. Now, this strategy that we've been using to go over aminomycins and the toxicity and side effects, so going from mycin to mice to ears to kidney, is called pinning. Okay, we're pinning one type of information to something that we already know about. So when you're studying other topics on your own or with your study group, look for ways that you can pin together information in a memorable way. Now, when you look at a kidney, we're going to pin something else to the kidney. The kidney, if you put a cross through the center of it in your drawing, it almost starts to resemble a number 8. Okay, it doesn't look like a 5. It doesn't look like 12. Okay, it looks like an 8. So aminoglycosides affect cranial nerve number 8. Right? And they're typically administered Q8 hours. Now, I also see these ordered Q12, but that's only when they're alternating between aminomycin and another class of antibiotics. So if they're flip-flopping, they might only do it Q12. If it's aminomycin on its own, you'll probably see it Q8. Right? Now, we talked about administration a little bit earlier. These are given IM or IV, typically IV. I don't think that I've ever given one of them IM. So you're typically going to see these administered IV, and they are rarely given PO. Right? Well, why not? They're not given PO because they are not absorbed through the lumen in your intestines, right? Through the wall of your intestines. Right? They're rarely given PO because they're not absorbed through the wall of the intestines. Now, you will see these given PO under two situations. Number one is in hepatic encephalopathy, which is also known as liver coma. And that results from an increase in the ammonia buildup in your patient. Okay, so it's due to a high ammonia level. Well, where does that ammonia come from? That ammonia comes from the E. coli in your intestines. Okay, so the E. coli in your intestines are like basically the number one contributor to the ammonia level in your body. And you'll see a couple different drugs used to excrete that ammonia level. You'll see lactulose ordered. Okay, now lactulose is basically a laxative, and it's going to cause that patient to have multiple bowel movements. Sometimes you'll see orders to titrate lactulose to a certain number of bowel movements per day. And that's designed to excrete that ammonia, because if you get rid of the E. coli, if you can get rid of some of those E. coli, so say you basically give somebody diarrhea, you remove most of the E. coli in their intestines, which is going to decrease the amount of ammonia that is produced. But if you need to get rid of that ammonia quickly or in a substantial fashion, you might see a PO aminoglycoside ordered, right? Because it's not going to be absorbed through the intestine, but it does work in the intestine. Okay, so it never actually enters your body. Because remember, just because you swallow something does not mean it's in your body. You could swallow a marble, right? And the marble goes through you, but it's never actually in your body. It never crosses the lumen of your intestine. So it will sterilize your bowels, and when else might you want to have a sterile bowel? Well, you may also see these ordered for pre-op for GI or lower bowel surgery. Okay, if we're going to be cutting into there, right, and there's a risk that some of the fecal matter in your intestines gets into your peritoneal cavity, right? That's how you get peritonitis. Okay, that's why a perforated bowel is such a big concern. That's why if you ever have a patient who's got a gunshot wound to the abdomen or to a stab wound to the abdomen, you really want to watch for that peritonitis. Okay, the concern for a perforated bowel in that situation is pretty high. On a random side note, where you may also see something like this, kind of an emerging field in GI is in fecal transplants. So you have these patients who have chronic diarrhea and lower GI problems that really start to affect their daily life. People who have serious irritable bowel syndrome, to where they eat and then 30 seconds later they immediately go have diarrhea. Really affects their standard and quality of living. So what they do is some of these physicians will give them something to sterilize their bowel. Okay, so a PO, aminoglycoside most likely, and so they'll have sterile bowels, and then they'll put down a Dobhoff tube, right, that goes in down through the stomach and into the patient's jejunum, and then they will administer baby poop, basically. So they will blend it up and administer that to the patient so that what used to be in their bowels was sterilized, and then what's now being administered is something that hasn't really been affected by life yet because it's coming from a baby, right? And it's pretty consistent, and it sounds really weird and kind of peculiar, but look it up. You may see it more and more in the future. But anyway, kind of an interesting concept, but applies to aminoglycosides, right? Because they're not going to be given PO typically, except for under those two situations that we talked about. So let's review real quick, okay? Aminoglycosides, they're big gun antibiotics, right? They're typically given for serious life-threatening illnesses, even things like cancer. So you're going to see them prescribed for things like sepsis, tuberculosis, MRSA. All right? Whenever you hear the word aminoglycoside, I want you to think mean old mycin, all right? They're not aminoglycosides, they're mean old mycins. All aminoglycosides end in the word mycin, but not all drugs that end in mycin are aminoglycosides. For example, the thromycins. And there's only 3 thromycins, right? So remember, all aminoglycosides end in mycin, but not all drugs that end in mycin are aminoglycosides. For toxicity, remember, whenever you're studying, try and pin information that you know to other information that you know. So we know that aminoglycosides are mean old mycins. So mycin sounds like mice, right? And the most famous mouse in the world is most famous for his ears. So we're going to monitor ototoxicity. So we're going to monitor their patient's hearing, their balance, and the ringing in their ears. We are going to pin that information about ears to the fact that ears look like kidneys when you draw the outline of them. So we're also going to watch nephrotoxicity by monitoring the patient's creatinine. Okay. The kidney also looks like a number 8, and aminoglycosides affect cranial nerve number 8. Right? They're typically administered Q8 hours unless they are flip-flopped with other antibiotics, in which case you might see them Q12. They're typically given IV, but can be given IM, and we'll give them PO only occasionally for situations like hepatic encephalopathy or pre-op for GI or lower bowel surgery. Now, before we conclude with aminoglycosides, let's do a little bit of critical thinking. One of the things that really helped me excel in school was as I was studying, I was asking myself, if I was teaching this information, what kind of questions would I write about this? Okay, how would I write questions about this topic? What would I expect my students to know about a given topic? Right? So if you were writing questions for the NCLEX, you might be thinking, well, what is important for the nurse to teach their patients who are on aminoglycosides? Right? So what kind of stuff would you teach your patient? You're going to tell them that you're going to be giving this drug to them a couple of times a day. You're going to tell them that they should let you know if they have any kind of ringing in their ear, if they start to feel like they have any balance or vertigo problems, if they start to have any difficulty hearing. So a question might ask you something like this. The nurse goes into a client's room in the afternoon, and the client asks to have their television turned up. Okay, well, what are you going to think about that? Why does this client want to have the television turned up? Okay, so critical thinking would say, are they having difficulty hearing? Right? So that's a good way to start thinking about some of these topics as you're studying. Think about what kind of questions would I be writing if I were going to assess my friends or my classmates about this material. So for aminoglycosides, which part of this order would the nurse want to question or clarify with the physician? So if the question says, the nurse is caring for a client on vancomycin for septic peritonitis, and the order is for vancomycin PO Q8 hours. Right? Well, we know that they have peritonitis, and vancomycin is an appropriate drug for that, right? Because aminoglycosides are used for big, bad infections, right? And we know that 8 hours is appropriate because, remember, cranial nerve 8. But we also know that aminoglycosides administered PO do not get absorbed. So for peritonitis, we do want it to be absorbed. So that's the part that we would question. We would clarify with the physician why it was being given PO and not IV. When you're studying for the NCLEX, think about how you would assess your students if you were the teacher. If you were writing questions for the NCLEX, what would you expect a student to know, a new graduate RN to know about aminoglycosides? All right? And if you do that with all the different topics that you study, you're going to do well on the NCLEX, because when you see questions on the NCLEX, they're going to be similar to things that you had already asked yourself. What did I expect myself to know, or what did I expect my classmates to know? All right? And that's a wrap up for aminoglycosides.